Welcome to The Thriving Mama, the podcast that teaches you not just how to survive, but to thrive in motherhood. I'm your host, Dr. Stephanie Davis. So I'm particularly excited about this episode because I've wanted to have a holistic dentist on the show for a really long time. And for those of you who are not familiar with holistic dentistry, it's exactly what it sounds like. They take a holistic approach to dentistry, truly considering how oral and, kind of from the neck up, all of that affects systemic health. And, from anything from how the bacteria in your mouth can promote or hinder health into like how your teeth map to organ systems, very similar to traditional Chinese medicine. It is a really, really cool version of dentistry. They also use more bioidentical materials. So there's no, the issues that you might have with mercury, for instance. So they're really looking at dentistry from a completely different lens than what most of us are used to. But this holistic dentist that I'll be interviewing today is very special because she is unlike any other that I've ever spoken to. She's very much like me in the fact that she doesn't only address what's happening from a biochemical and physical standpoint, she's also looking at the emotional trauma, spiritual side, which I absolutely love. And it's very exciting to know that there are people out there doing this. And so today I have a very special guest for you, Dr. Nirvani Umadat, who goes beyond the realms of typical holistic dentistry. And as I mentioned, she really gets into that connection between the physical and the emotional and energetic realms. She truly is a heart-centered quantum dentist. That is what when I read about her, and I've spoken to her multiple times, when I saw her, I'm like, she's like a quantum dentist. She's like something unique unto herself. And some of the main highlights from our conversation include what patterns you might see that link your oral, physical, and emotional health, and why TMJ is a red flag. Also, how trauma can help shape it. It literally changes the shape of your face and your teeth and what to look out for there. And lastly, what are the best ways to address that oral emotional connection when you are having symptoms and physical pain? Dr. Nirvani Umadat is a family practice dentist that's on a mission to help humans. Dr. Nirvani Umadat is a family practice dentist that's on a mission to help human beings fulfill their highest, fullest potential. In her practice, she meets patients where they're at and provides them with solutions from the physical to the emotional and spiritual as well. Her life's work and passion is mending the rift between science and source, using science to unravel the secrets of the higher consciousness. If you're confused about where to start addressing your own health, or you feel like you've tried all of the things but nothing has worked, I offer podcast listeners a free global health check where I'll evaluate your physical, mental, and emotional health and provide you useful resources to help you on your journey. You'll find that link in the show notes. Well, I am super excited to have Dr. Nirvani on today because when I was first introduced to her, I was super excited because I've wanted to have a holistic dentist on, but she is on another level. She's very analogous to what I do in the, functional medicine world, combining all of the, kind of different modalities that are, she's got the tools for holistic medicine or holistic dentistry, I should say, but she also has tools in the, kind of the mind, body, spirit realm, which is so cool because I've never met a dentist in that realm. So I was beyond excited to have her on here. So thank you so much for being on.
Well, thank you, Stephanie, for the invitation and for having me here. And I would say likewise, when we met and when we had our first conversation, I felt like I'd found like a soul sister, so to speak, in medicine and research. And so it's just really nice to connect with you and to learn about your philosophy and, how you approach health and healing and caring for patients. So I'm really excited to be here and have this conversation.
Yeah, I feel like this episode is gonna like blow people's minds because it's so like I said, you're the first person who I've ever heard like that, you're in the holistic dentistry realm and then you are bringing in the mind, body, spirit piece of it because you and I have a very similar background and that it was very like science and, conventionally based. And then, by and large, over time, it evolved. So I would love for you to share what your path has been like, because like I said, ours were very similar, but yours, like you did, like we talked when we first met the very first time, we talked about the case studies that we did and, how looking back on that stuff now, how we would do things differently or see things differently. So I would love for you to kind of share how that evolution has gone for you from where you started at to where you are now.
Sure. Yeah. I mean, it certainly has been an evolution and a journey, as you said. And I mean, my clinical practice started pretty conventionally, and I've been doing this now for nearly 14 years. So when I first started, I went to a dental school in Canada and started my practice in the hospital. Actually, I did a residency, and my intent at the time was to go into surgery. And so while doing that residency, it was combined with clinical practice and then research. And we saw a lot of trauma. We were a level 1 trauma hospital here in Canada. I was at Vancouver General. And in that space, in that medical realm, what we were noticing a lot was TMJ trauma and just generally TMJ dysfunction. And so in my surgical endeavors and then noticing what was happening in a lot of the patients coming into our clinical practice and just even post-surgical issues, I feel like I almost got walked into, without even overly realizing it at the time, this deeper understanding of TMJ disorders and dysfunction. And I have taken that understanding and that knowledge into my clinical practice. And over these years, the evolution of what I understand as really the root cause disorders in the body, but, in my particular case, in the mouth, in the head, in the neck, these things all originate with deeper sources of the root cause being something that goes beyond or beneath the physical presentation. So my research when I first started was, you'd mentioned the case studies that we talked about, but a lot of that research was very much based in modality assessment. So I was looking at, what were people doing as far as treatments and therapeutics and pharmaceuticals and manual therapy to address the issues that they were having with their joint and any dysfunction that was coming, as a result of TMJ dysregulation. And that's what my research was about. And that's what my papers were about. And over time, I have incorporated different aspects of, I would say maybe energetics into, how our bodies work, how our joints work, and the expression or the suppression of traumatic events in our bodies and how that actually manifests as disease. And, I wouldn't say that I have deeply studied German new medicine, but I have studied it. And there are a lot of aspects in some of the quantum studies that I've taken over the years that really mesh well with, the idea that your emotional state and the expression or suppression of emotions in your body leads to disease. And so that is where I sort of kind of really come alive in my practice now, I think, is putting all of that together and just recognizing that our physical expressions and manifestations are a result of something that is deeper and, quite frankly, much more energy based than than most practitioners are able to see.
Yeah, that's great. Like, I love that you brought up the expression or suppression of emotions and trauma, because that's obviously a huge foundation of what I do too. But part of my training when I did the coursework in HMT, there is German New Medicine in there. We talk about that a lot. And it's really interesting, like the TMJ, that is like in the kind of traumatic and emotional realms, kind of no matter what certain modalities are. Like, I know a lot of massage therapists and body workers know that, trauma can be stored in the TMJ or the psoas muscle. We get a lot of like the hips, women with tight hips and hip pain. And so it's interesting. Those are probably the two biggest places where we see chronic, emotional issues and trauma or anything of that nature manifesting physically. It's super interesting that you're the clinical and I'd say very kind of fundamentally medical aspect of, starting off there with the TMJ, and then, how you see it now, because something that I talk about a lot in practice is like when we have people who have that tightness in the TMJ, we liken it back to like either really, really intense anger or resentment or rage that has not been expressed. And I would love for you to dive into that more and how you see it kind of manifest in your practice. And then could you also talk a little bit about how you have that conversation with somebody? Maybe it's not, why, like the why is why are you actually clenching your jaw, or all of the things that can surround the paradigm of TMJ?
Sure. Yeah. I mean, absolutely. I would agree that a lot of the time when you see issues in patients with the TMJ joint, it is related to, quote unquote, biting your tongue, or, really clenching those muscles around your jaw, stiffening up, being unable to express yourself or speak your truth, or resentment or anger, as you said, like really holding on to something, keeping whatever it is locked up and keeping it tight and keeping your mouth shut. And all of that comes into, the more emotional side of like what is actually causing the muscles to contract here, and this neuronal response of just constant nerve firing where everything's tight. And so, I mean, that is what we see clinically expressed. Like physically, somebody will come in and they'll have a completely dysregulated joint or joints, meaning, they're sore, they're tight. They, the masseter muscles here along the side of the face in some people are quite big. Like you kind of get that almost squared out look. Can't open, can't close in some cases, like a form of either open or close lock to their jaw, an inability to eat certain foods, headaches. So there's all these types of physical things that come up when somebody will come in for a consultation regarding their joint. And a lot of it can really be limiting as far as quality of life. Because I mean, if you imagine that there's certain things that you can no longer eat now because of the way that your jaw is functioning or not functioning, that's a whole lifestyle piece in and of itself. But the way I try and navigate those conversations is, first, I will typically come at it from a very logical space and then work my way through a series of questions depending on where I can tell somebody is at. So, I mean, typically all of those things that I've just mentioned are related to stress in some way, shape, or form. So if you feel that you can't speak your truth, or that you're biting your tongue, or that you're just mad about having to hold on to a lot of things, that is all typically related to stress. So that's sort of how I open the conversation up with people is, do you have any stress events in your life right now that you can relate to when this either started or when you started noticing it? And so that's a really easy place for most people to tell you something. because most people are stressed at some level. And oftentimes you'll get a lot from that one question. So people will tell you, something at work happened and it's really been getting really tight since that, or something at home has happened. And that's when I noticed it. Something with my children has happened. And, ever since I've been dealing with that, I've noticed this. So depending on what I get from that, asking that question, that allows me to kind of sense where I can go and how far I can actually take the conversation into bringing in awareness to deeper emotional issues that could be causing this.
That's awesome. I love that you use stress to bridge the gap, because that is universally something we can all understand and relate to. And I think so much of this work is like what you were just talking about is, really meeting people where they're at. Some people walk in and they're like, I know I've been, biting my tongue and I haven't been able to speak my truth. And then there are some people who just like that connection is like, they have no idea. But then when you have the opportunity to illuminate that for them, it's like the light bulb goes on and they're like, oh my gosh, there's something, so powerful here. It's really interesting because I find in my, like we talked before about in my practice, I've seen a lot of autoimmunity, but specifically the most is Hashimoto's. And that again, it's like throat and, throat chakra. And again, not speaking your truth. TMJ. They all it's all TMJ. And it's really interesting because some of them may have been to other practitioners, like other functional medicine practitioners. And it's known well in that space that parasites, they're like, oh, parasites are like TMJ and clenching and tightness can be a symptom of a parasite. But why do you have that parasite in the first place, right? Like, why are you a person who actually is expressing symptomology of a parasite? So, we get back to that. And you and I've talked about the energetic aspect to, of it. I would love for you to dive a little bit into that a little bit more as well, is like the energetics and the vibrational aspect of what's happening with somebody who has like TMJ or like orofacial like tightness and issues. Cause I often see, it's TMJ and then it radiates to like the suboccipital muscles or down into the shoulders. So if you could dive into that a little bit too.
Sure. Well, I think what's really interesting to consider is that the TMJ, we've got one on the right side, we've got one on the left side. And really like in the movement of our jaw, of our lower face, both of those sides are, necessary and operational. So they both function simultaneously. They don't always function in the same way, especially if there are things going on that are quote unquote pathologic. But when you open, close your mouth, speak, chew, swallow, any of those things, both sides are operating. And energetic level, for anyone who's studied that type of work, we have our feminine, the left side of our body, and the right side masculine energetic flow that kind of complement one another. And we've got on each side, both feminine and masculine, a joint that is directly related to the functioning of our voice, our ability to speak our truth, our ability to project out into the world. And so it is interesting when you see issues in patients, is it localized to one side, which it often is, especially initially. The longer this dysregulation continues, the more things start to kind of, one side overcompensates for the other. But if you can catch these things early enough, there is oftentimes a side, whether that's, feminine, masculine, that is kind of the initial contributing source of this imbalance that you're seeing in the joint. So that is really interesting to make a note of, and being able to find out exactly where that comes from is a little trickier because that really dives into work that you would do, Stephanie, like really, going a lot deeper into the emotional or traumatic places. And so that can be a little tricky to navigate questioning around on my end. But in my practice, just from an observational standpoint, it is the case that usually there's a particular side that will kind of be the source issue for the joint to become, out of balance to begin with. And so energetically that is linked to, either maternal or paternal energetic lines, and oftentimes, whatever work needs to be done within those. So, I mean, that's one way that I've noticed that energetic connection. And then, I mean, another is just really, as you said, like a lot of what happens here in the joint, it's linked to, the greater aspects of our head and neck. And I mean, actually goes all the way down to our toes, really, but also back as well is a place that people oftentimes notice it. But just really even being comfortable in your own skin. And what I mean by that is like our positioning affects our jaw. So if we are uncomfortable, if you sit and you're kind of hunched over or uncomfortable, not able to kind of put yourself out there and feel open and feel welcome by the world around you, that affects your positioning and your posture, which ultimately affects your joint here and the positioning of your lower jaw against the base of the temporal muscle. So that in and of itself is sort of an indication as to, how do you show up in the world and how do you express yourself once you have shown up? And a lot of the time, as I said earlier, somebody who feels as though they can't express themselves well or is holding on to something, over time you start to actually see physically a change in the face where there is this like strong, more angular look that can almost be a little harsh looking. And that is typically a sign of somebody just really holding on to or repressing a lot.
Yeah, that's awesome. Like the shape of the face. And I can totally see that when I reflect back on people that I've worked with or people that I know who, interestingly, some of them will speak their truth in certain spaces, but then not in others. And like you had mentioned, going back to like the maternal or the paternal lineage, I think that's a huge part of it, because I think some people are like, I am who I am and I'm showing up in the world this way. But then if they were faced and had to say something to their parents or grandparents, they will hold back. So it's super interesting that you see it that way. Cause I've talked to, like, I've had a pelvic floor therapist on here, as well. And again, like the relationship to the posture and your confidence and how you're manifesting and embodying yourself in the world is like, there's so much we can get from that. And I'm also in my practice seeing like what you were talking about, like that's something I talk about too, when people have a pain or something we're going after in the emotional and traumatic realm that's localized to one side, and not, some people will have things centered, but a lot of people, it will be localized to the, right or left. And then, we talk about that being related to like the masculine and the feminine. And most often it does kind of come back to, the thought that mom or dad or, that type of stuff. And I could say for like my own experience, mine was I had the left-sided TMJ. And then a lot of my female patients have too, especially the ones that I was talking about before with like the Hashimoto's. It is a very real manifestation of that, just trauma, or so often it's suppression, suppressing your voice, suppressing how you feel, suppressing who you really are. And it's like you can only do that for so long before your body's going to be screaming with these symptoms. These symptoms are signs. And I always tell people, I'm like, you don't see it this way now, but it's like a gift, actually really, your body speaking to you, so it's like, it's a lot of it is framing it too, right? Like giving people the context. And I love how, like you were talking about that before, just like bridging the gap, talking about stress and seeing if the person is open to possibly seeing it in seeing it in another light, just expanding what their, mind is open to. are there, besides the TMJ, is there any place else that you tend to see a lot of these patterns where there is something being like suppressed, or, the certain expressions of trauma or emotional stuff?
Yeah, absolutely. I mean, the teeth themselves. So our teeth, the way I like to describe our teeth is that each one of them is like a little organ in your mouth. So each one of our teeth has a nervous system, it has a blood supply, it has a lymphatic system, and then it has, layer upon layer upon layer of different cells. So each of our teeth is a living system. And just like all of the other organs in our body, it has, each one of our teeth has these components that really bring life to it. And so when things are happening in our lives and when things are happening to us in an energetic or emotional realm, they can present, very physically like they can anywhere, but in our teeth. And I mean, some really, to kind of extend what we were talking about with the clenching or the grinding just a little bit ago, on your teeth, how that shows up is it actually looks like flattening of the teeth, or, we'll often say there's wear on your teeth. And for some people that can get so, significant that their teeth actually break or they chip. And, sometimes they'll crack right in half, like a perfectly virgin tooth, meaning a tooth that has never been restored, never had a cavity, wouldn't otherwise have a reason to break, will just split in half. And, when we start seeing these things, I know, people will lose teeth for this reason, but that level of trauma to the teeth and that level of wear to the enamel, which is, an incredibly biologically resilient, hard surface, when you start wearing that away, that is a sign, like the destruction of any other organ in your body would be, that there's something significantly wrong here, and it goes beyond just you don't have as much enamel. That's ultimately the sign of a symptom that goes much deeper. And I actually spoke with a dentist, Dr. Dorothee Bredgard, on my podcast not too long ago. And she, over her career, has mapped out, which is so interesting, but she's mapped out different emotional states and different emotional traumas and how those actually show up on the different teeth in our mouth. So she's created this emotional map, which is, for me, it was so interesting. And I believe she's the only one who's been able to kind of link these things together in that specific way. So, I mean, cavities, fractures, wear patterns, things like that, they will happen on particular teeth depending on what's going on with you at an emotional level.
Oh my gosh, that's so cool. I remembered you mentioning that before. And it's so cool that she's doing that, because like my holistic dentist that I see here in a lot of the rooms, he has there's a chart and it maps the tooth to organ systems, but it does not map it to like the emotions, which is I would love to see those like side by side, because that's a lot of like what we're doing too with like, in traditional Chinese medicine, how like, like where things show up on your body, it can map to different organs. I think there's so much insight and utility you can gain from that, because I have found that always to be accurate in my practice, especially with stuff going on in people's, like the jaw, first of all, but then also like, liver related stuff, gut related stuff, kidney related stuff will like shows up on the, the face. So that's really, really fascinating. And the piece about the enamel, one thing that made me like wonder is I have people in my practice who they don't have very robust enamel. And that's, something that they have, but it also might run in their families too. Most of the time, which I think is really fascinating, it's on the maternal side and not the paternal side. Do you think that there is anything to that, like not having strong enamel, what would that speak to?
Yeah, I mean, I think that's really interesting. That's an interesting observation that you've had in your practice. But I mean, I think that like that resilience piece is, if you are lacking, in this case, a level of physical resilience, and that's what enamel would be as far as a tooth goes, to really say that there is only a genetic component to that, I think, to take that one step further, absolutely. My belief is that there is probably, in this case, something along the maternal line that would be inhibiting the development of that extra, force of resilience on a tooth, for example. And it would be interesting actually to see if there are other, organs or organ systems on that same side that have, that are maybe not as strong, or different muscle groups that are weaker on that side. I would say personally, even for me, I would definitely say my left side in general, even just, doing yoga, working out, is weaker. Like I have to work a little harder to get my left side to do what my right side can.
Yeah. Isn't it interesting? I will tell you, a lot of these people have Hashimoto's and celiac, because Hashimoto's and celiac tend to come together in the autoimmune world. But a lot of these people are, they do have had a diagnosis of Hashimoto's. So like I said before, it's like, that your throat chakra and, all of like not being able to speak your truth, right? And not being able to speak your truth. I feel like, just kind of, this is evolving based on our conversation, but maybe that's like literally, like you said, the enamel is, how resilient are you on a physical level? It's like, maybe it's hearkening back to you just not showing up as who you are in the world, right? Like really like, and it's depleting different, different parts of your body because of that. It is really, really, it's so fascinating when you get down into all of that. Are you familiar with that, the tooth organ chart?
I am. Yeah. I think you're referring to like the meridian chart with the teeth leading to different, like through different meridians to different organs.
I think that's what it is. That's exactly what it is.
Yeah, I think Dorothy had, it doesn't necessarily, it correlates. It doesn't necessarily, or pardon me, it corresponds. It doesn't necessarily correlate. But what's interesting is she's repeatedly seen certain behaviors or certain experiences come up for people, that have this level of damage in these areas. So it's fascinating because it's all the same, like it's different expressions or variations of the same thing, which is that we are, these physical beings, and we have like such a deep energetic flow of all of this energy that really expresses itself through us. And then we get to see what that looks like on the physical level. And that gives us so much information about where we're functioning from and how well we're functioning.
Right. So when you identify this in somebody, when you're doing like your analysis of them sitting in the chair. So, and you had mentioned earlier that you might bring up stress and use that to kind of like bridge the conversation. When you are doing the work, like what are you typically recommending that people do? Are you doing it based off of like where you think they're at? If you think that this person might benefit from different, modalities, like how do you, go about giving them their recommendation?
Absolutely. So I, very similar to you. I mean, I try and meet people where they're at, and I don't believe in forcing anyone into anything. I think, when you work with people long enough, you kind of recognize that doesn't work anyways.
It does not work at all.
Doesn't work. So, I mean, on a very physical level, like if somebody were to come in and, they just want something quick, easy, simple, they want to get rid of some of the pain and some of the discomfort and want to be able to sleep well. I mean, there are things that we can recommend for that. For example, something that's very simple to make is a bite guard. And that's just literally an acrylic appliance. It fits over your teeth. We design it in a way where we, as ideally as we can, try and position your jaw in a certain way and have you bite into the acrylic in a certain way. And it does cover your teeth up and it protects them. And that's a very, physical intervention it's quick, it's easy, you use it every day. And for a lot of people, that's all they want. For some people who are looking for something a little bit deeper that actually gets to maybe a little more of why they're experiencing the discomfort and the irregularities that they are in the joint, there are exercises that we can recommend as far as building strength around the muscles in your head and neck. So I was saying earlier, like positioning matters. And so for a lot of us, we don't position ourselves well in a seated position. And so, I was kind of demonstrating this earlier, but you can imagine that if you're not sitting straight up, your head is either, too far forward, too far down, maybe in some cases too far back. And that is also doing all kinds of things to the ligaments and the muscles around your jaw joint. And it's either putting excess tension on the neck or the joint itself or all of it, depending on how you're positioning yourself. So just some simple exercises that are simple, not easy. So to really be mindful about how we're sitting. There are some exercises that we can recommend as far as, where your tongue is positioned in your mouth, how your teeth come together. So what the bite is like and being mindful of, for example, chewing with your mouth closed. So putting your food in your mouth, chewing your food well, like chewing your food so that you're swallowing completely chewed pulp, essentially, and then having your teeth come together and swallow in a way where your teeth are lightly touching. So these are just more, they kind of go one step deeper as far as being able to build some resilience, as we talked about in the facial structures around the joint. And then beyond that, if somebody is really willing to look at certain things, then, I have suggested looking at some of the pieces of what they've described to me in, as far as their environment or stress that could be contributing to, what's expressing itself in their jaw. So I just try and sense where the person that I'm speaking with is at. And a lot of people are in that first category and just want something quick and easy and be done with it. But over the years, I would say, and it probably has something to do with my level of understanding and openness to this as well, but I would say that second category of people understanding that there is some responsibility they need to take in making this better for themselves and building some strength. And maybe even that kind of pushes them into realizing deeper things about themselves. But a lot of people are willing to do that work where, they recognize I need to strengthen certain things. And this is a result of me, allowing this to go on and allowing this weakening to happen. And now I'm going to take hold of that and I'm going to take charge of it and I'm going to build a jaw and I'm going to build a joint and I'm going to build this physical structure that is much stronger than any of the weaknesses that I'm currently experiencing.
Yeah, that's huge. I love that you said that because you used a phrase that I use quite a bit. And it's like taking responsibility, because so often, especially in the realms that we're talking about right now, it's like that victim mindset, like that victim mentality of like, this is happening to me. When if you switch it, it could be happening for you. Maybe it's happening for you to open your eyes or bring awareness to something that's deeper, more deep seated in your body. So that's a huge thing. And that, taking responsibility empowers you. It empowers you to change and grow. And, like we talked before about changing your identity. And that's a huge, huge, huge piece of the puzzle. Like, I feel like that's a big unlock for a lot of people when I'm working with them and we're talking about that type of stuff. It's like the difference of something happening to you or against you, or, something happening for you that can, like I said before, kind of like be a gift, I know, like opening your eyes to other possibilities. So when you get somebody who has, like, let's say an immense amount of stress, or, when they are talking about their jaw, they might say, oh yeah, I had a tough time with my dad growing up, the issues on the right side. So when those types of things are happening, do you actually recommend sometimes that people like either go seek out therapeutic modalities like in the trauma and emotional realm? Or are you like saying, hey, maybe you want to start off with like journaling, or like what are your typical recommendations for people who or you think are open to, going that next step?
Yeah, I do have some people here that I refer to or that I recommend if I get a sense that that's something that my patient is wanting or looking for. I have some fantastic people here who do really good work. And I also ask, so, I mean, the idea of journaling for some people is very familiar and is a practice they do. And if that's the case, then I will say, well, if that's something you're already doing, then it sounds like maybe these are related things. Like you're describing something now that's related to, a relationship that you have, a close, strong relationship that you have in your life. And if you haven't journaled about that or put those thoughts down, maybe that's something you should start doing and see if you notice a difference with what's happening in your jaw. And for some people, that's like totally foreign. They don't journal. This is a very, all of this is kind of new, and they're wanting help, and they're wanting guidance still. So depending on where they are at, I can kind of go both ways. I think if you're like, for me personally, I think I could journal something out until maybe I couldn't. Like until I got to a point where I said, I think I do need to talk this out, or I do need to kind of explore a different avenue of dealing with this. And for some people, they would like that first, and then that opens them up to being more self-exploratory. So I think just depending on the person, that kind of gives me a little bit of a guide as to where to take them. And actually, thankfully in my practice, I see people regularly. So, at least every, 6 months, if they're coming for routine dental care, and sometimes more than that, depending on how, what their needs are. But sometimes the people that I've referred elsewhere, they will just start discussing the fact that they've developed another practice that has helped them deal with whatever it was they were dealing with, whether that's journaling or that's exercising, or that they've changed how they eat, or they're using different products. A lot of the time, that referral and that awareness around something that had been a part of their life allows them to kind of move into, as you said when we talked a little while ago, Stephanie, like that sense of deserving something else and making those changes that align with that.
Yeah. I know. I love that you do that, because by and large, a lot of the people who come see me know about the work that I do, but sometimes I get people who just, in our conversations, I can tell they're not quite ready to go there yet. So that's one of the first things I will have them do. Like, hey, maybe get out a journal, start writing this stuff down, and then let's, talk about it later and see, where you are at, what kind of resolution did you get, by doing this? Was there any awareness that opened up? And then I think, like you said, you could journal something out until you couldn't, until you realized that you needed, another step in that journey. And it's such a beautiful thing to be able to support people at different places and different phases, because it is a journey. It's not, I always tell people, it's like, I think in our society, we view everything as a destination, as like something with finality, but this isn't. This is like it's a journey that you keep on evolving. Like, it's funny. I I finally am not like this. But for so many years, like especially doing all of the like emotional and trauma work in self-growth, quite frankly, it's like you think you've arrived, and I'll be like, oh, I'm good. I don't need to do the practices that I'd been doing. And then all of a sudden it's like, that the universe is like, no, you're wrong. It will present you with a challenge that you're like, oh, okay, I still need to keep doing the work. So it's cool. It's so cool that you have the ability to assess this and like help people at different places and meet them where they're at, because that's such an important thing, especially societally, because we are in like such a fast-paced world where everything's like go, 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 do. And you don't have the opportunity so many times to like reflect back on these things or even see, where you were and where you've come to. So it's like being able to serve people and support them in that way is huge. And I love that you are an integral part of that journey for people. And I wanted to bring up something that you mentioned earlier, and it was like the bite guard and appliances. I know the very first time that you and I talked, we talked about things like the bite guard and airway expansion and different appliances. And I think that those are a really important part of the journey, especially the structural piece, and be able to get air. Air is like the breath of life, and it's something that we all need to survive. So I would love for you to kind of talk about that part too, kind of like the airway and breath as vitality and really supporting health.
Absolutely. I mean, if you are not able to get an adequate amount of oxygen into your body and to really take in that breath, like a breath in its fullest form for you, you inevitably end up less vital. Like we need the breath, we need oxygen in our body, and we need it literally to survive. And if through our airway being collapsed, so one way that starts is in the structure of the face itself. So, for example, for a lot of people, because of airway issues, and then trying to compensate positionally for these airway issues, and it oftentimes happens in children. So it's actually, it's a really, really important thing for parents to kind of keep an eye out for. And I know based on our first discussion, Stephanie, it's something that you've had an experience with. But, just really looking at how are the jaws developing in our children. And when the palate in particular is constricted, so when our upper arch is constricted, the bone that holds the teeth in the skeleton, so the maxillary bone, also becomes constricted. And then the airway itself becomes constricted, so everything kind of going down. And then ultimately our breathing becomes labored. And typically what happens to the face, as an obvious way to see these changes happening in children in particular. And then, oftentimes you can see what the results of untreated airway issues look like in adults. But for children, it oftentimes looks like almost like a rounding of the face and a shrinking of the lower part of the face. And, we call it a class 2 skeletal relationship, but essentially almost this like rounded out look where there's a very small lower face. So the chin kind of becomes underdeveloped, the lower jaw overall becomes underdeveloped, and there's this like retrusion of the lower part of the face. Now, that's not the only type of skeletal malpositioning that can develop, but it's a common one. And so with things that help the kind of disrupt that patterning, so like the bite guard is something simple that helps protect the teeth. But as we talked about, there are more advanced things that can be done. So orthodontics is, that's a whole realm of dentistry that deals with, oftentimes people think of that as moving the teeth around, and that's what it does. But in doing that, in moving the position of the teeth, our bone is so malleable, especially when we're young. So, for our children, when we move things around in the bone actually moves as well. Like it remodels to reposition itself around our teeth in this case. So a palate that was, very narrow and constricted, if we put pressure on the teeth in a way that allows them to move out and change position, and we kind of get a wider, more uniform arch form, that actually changes the maxilla, that bone that houses the teeth. And it can be done in the mandible as well, but it's most often done because of the way these airway issues developed in the top jaw. And I mean, that changes a person, and in often cases, it more effective in children. It's just easier to remodel bone in kids.
Oh, it is. Yeah.
But yeah, I mean, it's actually amazing. Like it's amazing how adaptable our bodies are. But when we do that, I mean, that changes the entire shape of somebody's face. And aesthetically, that has implications. And, that like strong jaw that we often attribute to masculinity, that naturally develops as a result of getting a better flow of air through our mouth or through our nose, and then through the airway itself. And really like focusing on being primarily nose breathing versus mouth breathing is also really important for the development of the skeletal structure. So we oftentimes find, and especially this is, sleep related and diet related in our society now, because we don't chew the same things we used to chew, and we don't sleep the same way we used to sleep. So our jaws have now become positioned in a lot of the time an anterior drop. So that means like the jaw has almost fallen forward. And when you try and bring it back, which is, oftentimes people will notice pain in their jaw when they're chewing certain things or when they move their jaw in a certain way, it's because that bone has totally changed shape because the position of the lower jaw has been forward for so long. So if we can reposition our jaw, and the trend or like the TikTok fad of face taping has really taken off lately, but I mean, there is validity to that, in that when you primarily focus on nose breathing as opposed to mouth breathing, and not, having your mouth hang open and taking in the majority of your air through the mouth and allowing that breath to just flow through your nose, that allows the teeth to come together, and that just allows a more stable position of your jaw overall. And that in and of itself, before you get into any type of alternative intervention, sometimes is enough to change the shape of the jaw and the functioning of your airway as a whole. But yeah, I mean, to your question initially, orthodontics can be a fantastic tool to really open up somebody's ability to live into their fullest self in so many ways, like aesthetically, functionally, and to really be as vital as possible. Like, and that goes throughout your entire body.
Yeah, I do have experience with that. I actually, when I'm working with kids, that's one of the first things that we look at. We're like, I look at the shape of their face. I talk to the parents about how they're breathing. Do they mouth breathe? Do they chew with their mouths open? All of that stuff. And I recommend them get the book, Your Child's Best Face, because of that. Like, my son was not a strong mouth breather, but sometimes at night I'd go in his room and see his mouth open, and he would chew with his mouth open. So I had firsthand experience with this, and it's fascinating. He's almost at the end. He is doing the expansion. So he's doing upper and lower expansion of the palate and the lower jaw. And it's really interesting because you can see, like, you're right. The shape of his face has changed. It is so crazy. It's like, it blows my mind, because every time we go in there, they do scans periodically, and you can see his arch, his upper palate has stretched out. And so it's interesting, because I'm looking at all this stuff. I look at it obviously from like a mechanical and biochemical standpoint. We look at it from like that traumatic standpoint too. A lot of it is like the midline issues, like the midline defects, and that harkens back to like a lot of the genetic stuff like the MTHFR and folate metabolism and certain other things in that realm that we know can be associated with midline issues. But sometimes it goes like way beyond that too. And I love how you also brought in the whole part about like from a, human history standpoint, we used to use our jaws a lot more than we do now. And it has resulted, like you had said, in smaller and like often receding or, like you had said, anterior positioned jaws. And it's been fascinating. And our dentist, it was like, because we have the device and we turn it, we do the top one we do every day, but the bottom one we can only do twice a week. Cause he's like, if you want to, and I give the analogy to wood, he's like, the top is like pine. It's a lot softer and you can go faster. He's like, the bottom is like oak. It's a lot harder. And I was like, it was just so fascinating to me.
Yeah. That's an awesome way to describe that.
Yeah, isn't it? I was like, oh, that makes so much sense because like I got that. Like I totally got that as a parent. But yeah, like I don't like people. I actually went through the expansion process myself too, because I had a higher palate. My airway was fine, but my palate was high and my teeth, I started to get overcrowding because, over time, all of the things that happen. And I can say that I can see it too, like my jaw, like it definitely expanded outward quite a bit. But for me, it's like 2 to 3 years. Whereas like my son, it's like less than a year. It's like fascinating. Like you said, it's so powerful to be able to do it in children versus, adults who it's like working with adults anyways. I always tell parents when I'm working with their kids, it's like, if I'm working with a kid, it's usually a very short period of time. If it's an adult, it's usually a longer period of time because we have so much more life history. And it's like not just the life history of like experience and what our bodies have gone through from like a biological standpoint, but it's also like the emotional aspect of it and the energetic aspect. There's so much more life history that we are uncovering and handling and working with. So it's interesting that you kind of touched on the working with kids versus working with adults, because I think that can look different too. Do you see a lot of kids in your practice?
Yeah, I have a family practice. So the practice itself, we have a lot of families. And yeah, I think, as you said, that's where you kind of get to one, like it just gives you really a true appreciation of, the human body and just how malleable we are. And especially, like how quickly these things can change with kids. And when we have the ability to sense certain things in kids and diagnose and then, treat. And sometimes that's really just a matter of giving advice. But when you do that in kids, like you just see such quick changes that I think that's where a lot of the power lies in, us as practitioners, like how we affect people is we can bring this down to that generation where they are more malleable, they are more open, and things happen more quickly. And I think when we get to do that, it's just such a cool, like the juxtaposition of doing that when you're working with adults, it just really makes you appreciate the power of, using a lot of these modalities and like how changeable we are.
Yeah, no, I agree 100%. I love that. My practice, it's family, but it's mostly like you probably see more men than I do. Most of the men I get in my practice are husbands, husbands of the wife and the children, the whole thing. So it's really funny. But yeah, working with families is like so incredible. But like you said, working with kids, it's like you can see the changes happen so fast. And it's so like, I love working with kids. It's one of the best parts of I love it. Plus when you change a kid's life, like there's so many things that they're so like, the world today is hard. It's like, I'm grateful that I'm not a child today. And that's what I say to my kids. I'm like, you guys are growing up in a tougher time than when I was little. And I try to always, instead of thinking about my experience, I try to think about the experience that they're going through, because it is, they are growing up with a digital world and a world full of tech and social media. And there's a lot that comes with that. So it's like, I think it's super important, again, like meeting people where they're at. It's like meeting kids where they're at too. So it's cool that you're seeing that in your practice and doing that in your practice. I just thought of something I wanted to ask you earlier that I didn't. So I'm going to circle back to a conversation we had earlier. When was it in your journey that you, like we talked about before, how you started off in the hospital setting and you were doing case studies and recording, what the different treatment modalities were, and therapeutic interventions. When did this awareness of like the energetic side and like the greater kind of like spiritual landscape, when did that, like, was there a moment that you kind of had an aha moment that stands out for you? Or was it just kind of something that evolved over time and you just sort of became aware of it?
I think it was really an evolution. And from our previous conversation, you said that you had kind of had quantum sciences in your awareness for a very long time, like since you were in high school. And I would say the same. So when I got into university, my first few years of university, I did a zoology microbiology degree. And while I was doing...
Me too, same.
Oh, did you?
Same exact zoology and microbiology.
Microbiology,
that's so funny. Crazy.
Yeah, that's funny. And in doing that, like as my part-time, like relaxation reading, I would read theoretical physics papers.
Me too. That's so funny.
We were both
That's
nerding
amazing.
out to the same things.
Yes. I love that. Oh, I love it.
Yeah, I love that too. That's not often that you find that. So yeah, I mean, I have always had this like really deep appreciation for the fact that reality is not as simple as, the physical world around us. And I think it was just, it was probably a lot of things over time, but I already sort of had that baseline of openness to alternative ideas and, different ways of looking at the world, different ways of approaching science. And when I got into clinical practice, I realized that things don't work the way they tell you they're going to work when you're in school. And the more you work with people, absolutely. Like, I think that's everyone at some point in their career realizes that. And then the longer you do it and the more people you see, you realize as well that there is this emotional component, both your own as well as that of the patient, that affects, somebody's outcome. And that was really obvious in surgery to me. Like the people who go into surgery, even if it's a minor surgery, like, for example, wisdom tooth extraction, if that is something that is deemed necessary for them, at that time in my career, I was doing that a lot. Like that was the beginning of my career and the conventional educational system tells you just take out wisdom teeth when they're impacted. That's a whole other thing that I could go into. But at the time when I was doing that, my outcomes for the patients who didn't think it was a big deal, were excited to do it, happy to do it, happy to be done with it, those patients always did better than the people who were very anxious, very fearful, very nervous, really hesitant. And I mean, on a really superficial level, very early in my career, I was able to put that together. And then, as you do it longer and longer, you get this awareness around the fact that emotion matters, like our level of emotion that we go into a procedure with and we go into a patient interaction with, as well as theirs, those kind of fuse together and create an experience, and that has an effect on the outcome. And I just noticed that more and more in my practice. One trip, I would say, like a volunteer trip that I had done with my husband, who's also a dentist, we went to the jungle and we did dental work in the jungle with a group that we had worked with a lot. And it was amazing. It was just like a once in a lifetime experience. And in doing that, we sat with a shaman who was telling us about the plants in the jungle. And I mean, there are millions of plants in the jungle, and most of them, quite honestly, are harmful to humans. Like it almost seems like everything out there is trying to hurt you. But I mean, from our Western perspective, we just don't have that. Like, the people who live there, they are at one with nature and they are at one with the jungle. They don't look at it as them and the outside world. It's all the same. Like it's all variations of the same thing. And so he was, rattling off what all of these plants could do and how they were medicinally beneficial. And there were some that they would use for dental pain. And when I asked him, how do you know this? How did your tribe figure this out? Because there are so many plants here and a lot of them you can't use and they're harmful to you. And his answer to me was, if you listen, the plants tell you. And that to me, I think is, yeah, right? Like, it's one of those things where like, you don't know until you know. And now I know, like, I know exactly what he was saying. And at the time I didn't necessarily, but I knew it was something that I had to understand better. Like I knew there was something in there that he knew that I didn't, and I wanted to know what it was. And it spoke to me. And so that is probably a moment in my life where I really understood like what it meant to tune into the universe and what it meant to, feel energy and sense energy beyond, what is readily accessible to most of us, which is like the physical world, which is the densest, heaviest expression of energy.
Yeah, absolutely. I love that you mentioned that. And that's how your journey occurred, because I can't remember exactly what number of podcast it was. It was in the first, probably 8 that I did. I think it was probably in the realm of number 3 to number 8 or 9. But I interviewed a good friend of mine, Dr. Maya Shitri, and her journey was very similar. Like she started off as like a pediatric neurologist, went into functional medicine, then went into plant medicine. She did go into the jungles and had like that similar journey. And she talks so much about that. Like that whole episode was on plant medicine, but that she used the same words. It's like the plants speak to you. There's a knowing, there's a knowledge. It's not like they did what we do, very, again, it's like that reductionistic approach and that the scientific method where like, let's go take each plant. Let's see what the extracts are. We'll run MC or GC, like chromatography to see what's in there. What are the compounds that we can essentially exploit? It's like listening to it, first of all, listening to it and hearing like what it resonates back, but also like using it as its whole self, and appreciating the essence of the plant for its whole self, and not trying to reduce it down to what is the main compound that's giving us these benefits. And I feel like it's such a good analogy for life, because it's so often we're trying to reduce things down to what is like the cause, or what is the, I use the analogy a lot, lowest common denominator, when we should be like expanding and thinking more about the collective and the aggregation of like energies and, everything in our worlds, rather than trying to parse out every little thing. It's like, it's so cool that was your experience, because sure, I can only imagine being down there and hearing a shaman say to you, I'm listening to the plants, right? It's so cool. It's like, that's the type of thing, like for me too, like that would make me like want to dive into that head first. It's so funny, because that's like that for fun still to this day. I'm not reading. I will read like some fictional type of stuff, but for fun, I'm still reading stuff like that. That's the type of stuff I'm reading. I'm reading about like plants and plant medicine and quantum physics and things of that nature. Like, it's like, that's the stuff that excites me and lights me up, and like the interconnectedness of everything, rather than, trying to like totally tune out and, go down like the fiction or fantasy world. It's like, yeah, I can totally resonate with that. Well, again, like in interest of time, you've been so gracious with all of your knowledge. And so like, again, like I said, for people at the beginning, this is going to be mind blowing, because it's not often at all that you meet somebody who's in the world of dentistry, who's viewing it from this lens and helping people, literally like taking their hand and physically and like kind of energetically and walking them on that journey and being such an integral part of the kind of the self-growth, the expansion, the, being more like authentic and, who you are. I mean, at the essence of all of like what we're doing on the healing side is that, we're trying to get people to step into, be the person that they deserve, but also authentically be themselves. Because like you had mentioned, there were so many little things that you said that we could have gone off, I know, on tangents on, but like your posture, how you're showing up in the world, right? Like I think the more you feel, you're stepping into who you are and you feel so strongly in your conviction that what you're putting out in the world needs to be heard. Like you are more confident and your posture is better. It's all of these things are intertwined, but we don't think about them that way. So thank you for, just shining a light and, just bringing some awareness to another aspect of how we can observe ourselves in such a way that it gives us more than meets the eye. There's a deeper connection and a deeper level to what the work that you're doing. So I love that. I love what you're doing. I know I could talk to you for hours on end about what you do.
Yeah, likewise.
I know, right? Is there any last pieces of information you want to leave people with, or, where can they find you? That type of stuff.
Sure. Well, I would say, just to follow up on something you just mentioned, Stephanie, I am in complete agreement that, I think the idea that we should be looking at ourselves and our lives and our time here from a perspective of expansion is so important, because we really are more than just the sum of our parts. Like that idea that comes from, Newtonian science is that you can kind of parse out every little thing and figure out what every little thing does. And in doing that, you have an understanding of the whole thing. And almost nothing actually really works that way, including us. Like we have a vitality and a life force and a divinity that moves through us and around us and between us. And it connects us to, whatever way, feels resonant for us to put this. But for me, I'll say it connects us to God. And when we can start to understand that I think is where we really unlock who we truly are and how we show up and how we experience this life that we get to live here. So that's what I will say. So thank you for giving me the opportunity for this discussion. It was so much fun. And I just feel like we have so much alignment with the paths that we've taken, which is also just so nice to connect on. And then as for where people can find me, my clinic website, if anybody is interested in visiting me in central Canada here, it's ascentdentalcare.ca is my website for the office. And then personally, drnirvani.com is my personal website. And there I dive a little bit more into the energetic components of science and scientific study. And you can also find me on Instagram at Dr. Nirvani Umadat.
Perfect. Thank you so much. And I encourage everybody to go check out her information. She also has a podcast too. So you could check out her podcast and I would love for you to go explore more of what she is, the information and what she's putting out in the world, because I absolutely love it. And we will have the links for all of that in the show notes. So thank you again. Thank you so much for coming on. If you made it this far, I truly appreciate you. Remember, knowledge is just the beginning. Taking action is what truly sparks change. If you're overwhelmed and don't have enough energy to make it through the day, I invite you to book a free 20-minute coaching call with me. It's a no-obligation chat where we can discuss your health goals and how I might be able to help you achieve them. Visit the link in the episode description to book that call. Until next time, keep striving for wellness and remember, you have the power to not just survive, but thrive in motherhood.